Okay, so now you've decided that, managed care is really the way you want to move forward. You've decided we're going for it. We're going to decide to move forward with contracting with MCOs. And so the first thing that we're going to need to do is get you credentialed. Just by show of hands, and if you don't know, that's fine. How many of your agencies are already registered in Impact? Just by show of hands. So we've got quite a few. So what we're going to talk about today, if I can move this forward, I promise you. So we're going to talk about getting credentialed. First of all, we're going to talk a little bit about how you get registered in Impact, the credentialing system at HFS. Then we're going to talk about the universal roster, which is another step that you take to not get credentialed with the MCOs, but make sure that you are part of the MCO's provider database, and that you get listed in their directories, and that you're ready to be set up to process claims. And then just, how do you make those changes as you go forward? So with apologies to those that are already registered in Impact, and I would love to hear from you if you have tips and tricks, because it's not necessarily the most simple of process. Well, it is simple and it's not simple, let's just put it that way. So let's just talk about the difference between Impact and the universal roster. Impact is the HFS, and it's all online, Medicaid credentialing system. So MCOs do not credential providers. And when I say credentialing, I mean making sure that you have the appropriate certifications, licenses, professional qualifications, and the Department of Healthcare and Family Services said, yes, you are credentialed, you are a full-blown provider for the Medicaid program. So that's what Impact does. Credentialing on its own, just because you're in Impact, doesn't necessarily mean you're good to go with the MCO. Just because you're credentialed in Impact doesn't mean you can start billing an MCO just because they're a Medicaid MCO. You have to have a contract, right? So you have to make sure that you have contracts signed with the MCOs before you can actually start billing them, and that you meet all their contractual and operational requirements. And the universal roster is really a separate database of provider information. So the state does transfer the Impact files to the MCOs. So the MCOs know that provider A, B, and C have gotten the okay from the state and they're credentialed to provide services. But all the information that you put into that Impact system, because of system technical issues, which I believe the state and the MCOs are working through, it doesn't all come over to the MCOs. Why? I don't know. I'm not a techie person, but for some reason it doesn't. So you will see there's a little bit of duplication, but there's also a lot of information that the MCOs want from you to put in their provider directories, so that the member can go on their website and see, yes, provider A is with Illini Care, or provider B is with Blue Cross, or whatever. So the universal roster is really not about credentialing. It's not about whether you're qualified to provide a particular service. It's really just for them to manage their contracts, manage their billing systems, and make sure that the provider directories are all up to date. So in terms of Impact registration, there is a ton of resources on the Impact website, and I would definitely encourage you to play around and do some digging on that website. They have webinars and they have presentation materials for all the different types of registrations that really walk you step by step on how to do the registrations. So FAQs, a bunch of stuff on that website. So I would definitely, if you have questions, I am not an Impact expert. I sort of know enough to be dangerous, as they say, but I would definitely encourage you to check out the website if you have questions, and there is an email info box that I think the state is pretty good about answering questions that come to them. It's really important as you're going through the registration, how you register an Impact is going to affect how you get reimbursed. So it's really important that you fill out, and we'll talk a little bit about this, all the specialties that you provide, all the subspecialties you provide through that Impact system, because if you're not registered as say you're a community mental health center, if you don't put in that you have certain subspecialties that you provide, there's certain services that if you billed for, but you didn't register that you do those services, you're not gonna get paid. So it's really important that you use the right provider type, the right taxonomy codes, that you list all those specialties and subspecialties, because it does tie out to how you're going to get reimbursed by the MCO. So let's move on and get into a little more detail. This is just your overall basic checklist of things that you're going to need to have on hand. Once you go into the impact system and get registered, you have 30 days to finish. Once you start the application, you get 30 days to finish it. So you got to make sure that you have all these things in place, because the last thing you want to do is start and then you realize, oh, I don't have an MPI, and although the MPI process is very quick, but you just want to make sure you have all your documentation, all the certifications, all those license things that you need on hand and ready to go when you go to start your registration in Impact. If you are an agency that gets, if you're the payee, so your agency is getting paid directly, you need to make sure that you have a W-9 on file at the state. So make sure that that's up to date. Make sure all the providers that work in your agency have their certifications and professional licenses up to date. As I said before, this is a total email system and an electronic system online. So make sure that you have, what we recommend is really having a separate impact email, so that if someone leaves your organization, you have an impact email that anybody can use in your organization. Make sure your internet browser's up to date. And the first thing you're going to need to do is create an impact account. So you don't actually register. The first step, and we'll go through this a little bit, is to create a new impact account. And there's presentation materials. It's called the single sign-on. So that's the first thing you're going to do, is create that account. And in terms of the specialties and subspecialties, on that website, you'll see on the right-hand menu something called provider types. And that's an Excel spreadsheet that lists all the different types of providers with the specialties and subspecialties that are available to register for in Impact. And it will tell you sort of what license and certifications you might need. Yeah, Jesse?
But it has to be services you're currently providing.
Yes.
It cannot be services
You're thinking about.
or you wanted to do or yeah.
Yes, exactly. Did everyone get that? It is only for services that you currently provide. You can't put in, oh, one day I want to do, X, Y, and Z service. It's only for those that you have currently are offering and have certifications or licensing to do. And then if you do have DMH contracts or DCFS contracts, on that spreadsheet, you'll see at the bottom tabs for the various, like ADORS, if you have rehab services you're providing, some of those, special instructions for those services as well. So it's all laid out for you. It has drop-down menus, so you can check, if you only really do behavioral health services, you can deselect all and just put in for behavioral health services, so you don't have to scroll through, hundreds of physician types kind of thing. So this is sort of the overall registration flow, very high level. And unfortunately, I know that you guys have printed copies, but if, so I have the, hyperlinks listed here, and we can maybe send this section. I know that unfortunately the deck is too big to send to Carrie, and I couldn't, but we can send out this section so the hyperlinks will work directly for you. So you're going to start by creating that impact account, which is that single sign-on presentation, and you're going to fill out all that information. The state's going to get back to you and say, here's your impact ID number, which means you're ready to go to start registering in Impact. Once you get that, the next step is to register your organization as a global entity. And then potentially, if you use an outside billing service, so you're not submitting claims yourself, if you use an outside agency, you're also going to have to register your billing agency. But again, there is a separate PowerPoint on the website that walks you through how to set up your billing agency. So in terms of an organization, you're going to have to pick from 3 different enrollment types. You're either going to be a facility, agency, organization, also known as FAO, a group practice, or an individual sole proprietor. So let's talk definitions a little bit. An FAO is an organization that is required to hold a license or some level of certification. So if you're a CMHC, or you're an FQHC, or you're a hospital or a nursing home, you have to be licensed by the state, And that's how you know you're going to register as a facility, an agency, or an organization. A group practice could be a group of, or a group of providers, individual providers, but they're structured in such a way that they don't need a state certification or a state license. So if you're like a group of psychotherapists that work together, or a physician practice that work together, you're going to be in the group category. And then finally, the individual sole proprietor is sort of speaks for itself. It's you're just hung out a shingle, you're a therapist, or you're a physician, then you're going to register as a sole proprietor. Make sure I got all this right. Yes. All right. Any questions on where you might fit? And the definitions, again, are all on the website if you forget. So once you've done that, you're going to, you've got your agency registered or your organization registered. Then you're going to go in and start registering all the individual providers within your organization. So for instance, if you're a CMHC and you have LCSWs, LCPCs, maybe you have a psychiatrist that works part-time, you're going to go in and register all of them with the appropriate licensure, specialties, et cetera, and it's going to ask you to tie them back to a particular agency because it's a separate, if you will, process. It's a separate application. So you're going to finish this application, close it out, I'm done. You're going to wait for HFS to say, yep, you're good to go. And then you're going to go in and start registering your individual providers. It's going to ask you to tie it back to this agency. So that's why you can't start registering all your individual providers before you do your organization first, because it all ties back as you go. So a rendering or service provider is really someone who works in your organization, provides service, but is not getting paid directly. You're paying them. They're not submitting claims, right? So you're submitting claims on their behalf for the service they provide. So once you're all done doing all the registration, you're going to close it out, and you're going to wait for HFS to come back to you with your provider information sheet. And it's going to show you everything that you've registered for with the taxonomy codes, the MPIs, your TINs, all of that good stuff. It's really important that you quality check that document to make sure that you didn't mistype or key something in incorrectly, because that's what is going to be sent over to the MCO. You got to make sure that, oh, wait, I forgot to add Dr. Jones. I better go back in, because if you then submit a claim to the MCO for Dr. Jones, it's going to deny because they're not registered, right? Or they may be registered in Impact, but they're not tied to your organization. So when your organization submits a bill for what Dr. Jones did, it's going to deny. So really make sure you do a tight quality check on that provider information sheet. So that's Impact. That's just getting credentialed. So the state knows that you are qualified and certified to provide service. You also have to submit the universal roster. This is a spreadsheet, a roster that is used by all the MCOs. So you don't have a different one for each MCO. They all accept the same roster, and you have to use the roster. You can't kind of just send them an email with the information. You have to use this roster. You can't kind of make up what you want to tell them. So it's really important you use the roster. It's on the IMHIP website. So IMHIP is the Illinois Association of Medicaid Health Plans. Their website is right there. Under Provider Resources, you'll find the spreadsheet. And as I said before, there's some information that comes over from the state, but there's also some that does not. And so it's really seeking to kind of complete the picture for your organization and your service providers. And some it's not going to be applicable to your organization, but that's why we have the universal roster. And because it is so important, and it's fairly new, it's been out for a while now, but IMHIP has regular webinars on the universal roster, so check their website, and they do these monthly lunch and learns, and I'm assuming that they will have one in the next, I would say, quarter on the universal roster. And we can ask Samantha when she's here a little bit later. And the MCOs are always happy to help you if you have questions or concerns about the universal roster. So just some basics. The first bullet point is the most important. Just like we can't overemphasize document, 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 it's really important that you submit your universal roster to the MCOs at the same time you submit your impact application. We'll talk about that in a little bit, but there is no need to wait to hear back from HFS that you're all credentialed and good to go with the state. Submit your roster. The MCOs are going to start inputting that data, and they're just going to hold it in their little database, not little database, big database. They're just going to hold it there until they hear from HFS that you're credentialed and everything's okay in impact, and then they switch, turn the switch and you're live. But please do not wait. Submit it at the same time. Again, you have to use the spreadsheet that they provide for you. So in terms of filling it out, please do not change the spreadsheet in any way. Don't delete columns just because they don't apply for you. Don't hide that column. Please leave the format the way it is. If there's information that is not applicable to you, leave it blank. That's also very important. Don't put in not applicable or an asterisk or something. Just leave it blank. This is all done electronically. And so if you put something in that box that's not applicable, like an NA, it's going to screw the whole thing up. Just leave it blank. Their systems know to just ignore it. Yes?
Hi, when you're hiring someone, do they have to have their own, like, so for licensed impact on their own? And then when you hire them, you do another route, you add them to your route?
If they are already in, are you saying they're already in impact? You just have to go in and associate them with your agency. So they may be in there and they're good to go because they're working part-time over here and part-time. You just have to make sure that they're tied to your agency so that when you submit the claim, it shows that they actually work for you as well.
How about if they don't have their own impact yet and you are trying to hire them? Can you help them?
Absolutely. I would encourage that. Absolutely. Yeah, definitely. Oh, yeah, so if you're, good point, thank you, Angela. If you are adding someone, so they're new to your agency, they're coming from out of state, if you are adding them into impact, make a change to your universal roster at the same time. Always make sure you're submitting, if you're doing anything in impact, a change or a deletion, always submit the roster change at the same time, okay? And that's to benefit you. It's not, it's just to make sure that you guys don't get screwed in the process, okay? So the one thing that you can change on the universal roster, you can add extra lines, because certain providers have a lot of different service locations, so you can add lines. But don't change columns, don't put information in or text in where it's not required. And if the roster that's received is incomplete, the MCO can't load it, it'll come back rejected. And they'll let you know if that's the case, and you can work through them to make sure. While the universal roster structure and format is standardized across all the MCOs, I would recommend that you still talk to your MCO about how they want that submitted and who to submit it to. Some people have it sent to their provider data management. Some people want it to go to the provider rep. Just make sure that you're clear with them. Who am I sending this to? And how often do you want to see it? If you're a very stable organization, you don't have a lot of staff turnover, you could probably do it every 6 months or every quarter just to make sure any additions or deletions or modifications are kept up to date. If you have a lot of turnover, we really recommend you send it every 30 days. And again, check with your MCO that you're contracted with, because some people will accept, just send me your additions, send me your deletions. You don't need, if other people are just the same, you don't need to send that to us. Some people will want to see the full roster, and it has to do with how they load it into their system. So just check on that. So when do you submit your universal roster? The same time. And that's because the effective date of that provider in the MCO's billing system is tied to all those things coming together. And so the effective date of that provider, that when you can start billing the MCO and get reimbursed for that provider, is either going to be the effective date of the contract, when they're effective in impact, when the state has said yes, they're officially credentialed, or the date that the universal roster is submitted. Okay, so what that means, and I write this down because I get myself confused all the time. So say you have an effective contract with Blue Cross starting April 1st. So you got, what is it today? The 10th? So you get all your stuff together, you submit your impact registration on February 15th. The amount of time that the state takes to complete, and it depends on the complication of or how complicated, I guess, your impact registration is, but the timeline between submitting that application and HFS approving it can vary. Right now, they're a little bit behind because there's a new federal rule about who has to be in the impact database. So it can take up to 45 to 60 days sometimes. They're trying to get it down to closer to 30 to 40. But just knowing that, you just don't know. So say you don't get your impact application approved until like March 30th. And then you decide to submit your universal roster. Or you decide to submit your universal roster, I don't know, April 5th. So you've got an effective contract, but you can't start billing for any services you provide from April 1st to April 5th because you haven't submitted your universal. Oh no, I know it. So once you submit, so say you get it March 30th. HFS says you are good to go. You can start billing Medicaid, and you submit your universal roster March 30th, the day as soon as you get that from the state. The MCO then has 30 days. It's not just a real quick process. It takes them up to 30 days to get that loaded. And so it's just, if you're losing time in terms of when you can bill for services provided. So if you submit your universal roster at the same time, back on February 15th, the MCO will load it. So it's going to be loaded no later than March 15th. Excuse me. And they're just going to hold that there. There's nothing, it's sitting inactive in their file until they get the word from Impact that the registration is complete on the Impact side, and they flick the switch, and everything's good to go, and you can start billing. So even though you may say, well, wait a minute, I can't submit a universal roster. I'm not registered in Impact. I haven't got credentialed in Impact. Doesn't matter. Submit it. The MCOs are going to load it. That way, too, if there's any issues, like you're missing some information, you've got some time to work with to make sure that universal roster is loaded. I'm sorry, I make that way more confusing than I need to. I just know I sit in these meetings on Monday and people are still confused about, well, wait a minute, I'm registered in Impact. I can't send my roster in. Please send your roster in at the same time so that you don't lose any ground or lose any services that you're delivering without getting paid. Does that make sense? And then I'm happy to talk offline if folks are confused, because I get myself confused, I'll be honest. Okay, so let's just talk a little bit quickly about filling out the roster. I know we're getting up to a break. When you go in, you'll see it's a spreadsheet, Excel spreadsheet, multi-tabs along the bottom. The first tab is just general instructions. It's a yellow tab. Just read over it, make sure that you have all that information. And then there's 3 different sections along the bottom: facilities, practitioners, and groups or locations. We call them groups. And those are green tabs, which is the green tab is where you're actually going to input your information. Just before that green tab, there's instructions specific to that section. So there's the individual practitioner tab in green. To the left of that, you'll see instructions. Open that up, and it'll show you the instructions for that tab. Each sheet, some things are drop downs, some things are free text files. Some are yes, no, or you put an asterisk, things like that. So each field might be a little bit different. But if there's a drop down, use the drop down. Don't kind of just say, oh, I'll just type in. Please use the drop down. So this is where it gets a little hairy because the definitions used in the universal roster are a little bit different than what they're used in Impact. Because this is not a credentialing system. It's just a provider database. So practitioners are just practitioners. That's really pretty much the same. So those are folks that are not, they don't have to be sole proprietor. It could be either a sole proprietor or individual rendering providers. In this case, facilities, remember before I said a facility could be any organization that requires a license or a certification? For this roster, a facility are only those organizations, and this is getting into billing weeds, that bill on a UB04 or an institutional claim form. So things like hospitals, nursing homes, things that are going to get payment for a facility fee. So a residential treatment center, sort of anything that has like an inpatient care or gets reimbursed for facility costs. So UB04 837I electronically, just write that down. If you don't bill for institutional things, you don't even have to worry about this tab. In the universal roster, groups are all those other agencies. So FQHCs, CMHCs, group practices, all of those fall under the group instead of the facility under the universal roster. And again, the definitions will all be in the spreadsheet. You don't have to worry about remembering too much of it now. So just to give you some screenshots, as I said, this is the individual practitioner tab. Here's the yellow instructions. That's just general overall instructions. Here's the practitioner data. This is what this is showing now of all, oh no, this is the directions, pardon me. So you can say, here's provider status, the different sections. This is what the data field is. It's going to tell you, okay, in this data field, you're going to put text in. It's a free text form because you're writing either ad, term, whatever. Again, this is used for both MMAI and Medicaid, so ignore this column for now. But if you're submitting this to participate in their Medicaid product, this is required. So you'll see all of the ones that you have to submit, and then there are some if applicables. If it's not applicable, what are you going to do? Leave it blank, exactly. And then it'll show you what the acceptable data is that it'll accept under that tab. So this is just the actual data elements. You'll see it goes across. And you can flip back and forth if you get to a column and go, wait a minute, what does this mean again? What am I supposed to do? You can flip back and forth. So you're just going to fill it out just like any other spreadsheet. The other one we want to look at is the group one. Again, these are some are going to be applicable, some aren't. And again, this is where encounter rate clinics, FQHCs, CMHCs, BHCs, group practices are going to fill out the information. And you'll see it's very similar. There's your instructions tab going through, what is a text field? What do they want to see numbers in that field? This is required. And then any specific, like the format of the phone number needs to be a certain way for the file to come over cleanly. And there it is again. And then finally, facilities. Just in terms of the definition, remember, if you file an institutional claim, either as a UB04 or electronically, this is the tab you're going to fill out. And I don't know that we have any in the room. I know there was a couple of people, I want to say Loretto Hospital maybe was on the list today. But anyway, if you're a hospital, a nursing home, a residential treatment center, you will have to fill that out. All right, this is important if you provide, under the individual practitioner tab and the group tab, and we'll talk a little bit about this when we get into behavioral health billing, but there are certain specializations and special services. If you're an individual practitioner, you'll see towards the right on the spreadsheet, it'll say, what special services or specialized services do you provide? And these are, it provides you along the bottom, you'll see a tab towards the right that says behavioral health specialties. You need to pick if you are, you work on anxiety, panic disorder, you have, you provide treatment for ADD, ADHD. So you're going to just list, and you can pick as many as you want as long as you're certified appropriately and licensed certified appropriately to provide those services. But again, when it comes to mental health billing, because they have different groups of services that agencies are allowed or not allowed to bill for, you really got to make sure that you've added these to your tab. Does that make sense? And then this really only applies to facilities, so I don't know if there's residential treatment or other facilities in the room, but there's certain things that they want to see, like if you have extended office hours, please include that. If you provide crisis services at your facility, please add that, again, so that they have the appropriate thing, not only for billing, but to make sure that they can put that in their provider directory so that the members and the clients know that those services are available at that location. And some of these things, before you tear your hair out, because it's a lot of information in this impact file, or this universal roster, pardon me, a lot of it is required by law or by contract. A lot of the patient advocacy groups said, we need to know what are the office hours, what days do they work, are they ADA accessible, are they LGBTQ friendly, things like that. So a lot of what you'll see is the work of patient advocacy groups that want to see more robust provider directories. So it's really, at the end of the day, to help the members, make sure they're finding a provider that's the right fit for them. So just to wrap up, please remember, submit the universal roster at the same time. A lot of the information, if you're doing your impact registration, a lot of it's going to be similar information. So it's a time-consuming exercise, I won't lie. But once you've done it once, then it just becomes a question of adding and deleting. So please only use the format that's on the website, and just check with the plan on how often or how they want to receive those files. And then once you've done the universal roster and you've got your provider information sheet from HFS and you've got a signed contract, you're good to go. And then we're going to get into how do you actually start submitting bills for services. So any questions on that? I know a lot of you are already impact registered. Is there anyone here who's done the universal roster, who has a contract and has done the universal roster? Any tips, tricks, like, oh my God, it's horrible, or it's long, I know. And you know what? It's interesting, at one of the recent meetings, I don't think the state realized that there was a lot of duplication of what providers were having to submit. It was actually a dental provider at this meeting that said, it seems like I'm sending the same information over and over and over again. And I don't think the state realized that they just assumed that everything that was an impact was just coming over to the MCOs. And so now that they know that, I think there's a work group working on how can we make this impact transfer more robust so that the providers don't have to be duplicating a lot of that information. But I mean, if you're a large organization, it does take some time, I'll be honest, yeah. But you only have to do it once, and then you just have to add, delete, or maybe you're not, I don't know.
And the MCOs are trying to synthesize the impact data, so they're getting getting universal rosters from every single provider in their network, and then trying to synthesize what HFS is sending them in the impact file, which, as HFS just realized, is not necessarily correlate with what has to be on the universal roster. So it is a bit of a conundrum to organize all of this data on an ongoing basis. And the bottom line is if this isn't done properly, the providers don't get paid. So whether it's the impact side, so many times when I was still there, it was impact that was the problem. So the data coming from HFS was not right. And so it wasn't synthesizing. So we had an electronic system that took your roster and took their system and ta-da! And when one of these things doesn't work, it's definitely a challenge to work through. But I think, like you said, HFS was surprised that the universal roster was so necessary. And now I do believe that they are trying to figure out how to simplify it for the payers and the providers, because it is a lot, for sure.
And we also have, ICOI has a recorded webinar on the universal roster that Samantha Oldfry, who will be here later from IMHIP did for us. So there's another resource. If you just haven't gotten enough trainings today, you can go home and watch another webinar. But it goes over that in detail, so you can have that. And I'll make sure to send that. It's on our website, but I'll send that out when I send the slides out as well tomorrow.
Yeah.
We weren't providing a certain type of service at registration impact, but we are now. Is that something we can go back and
Absolutely, you can modify. When you go into impact, you can either like start a new application, or I think it's either modify or change current application. So you can always go in and modify your impact registration as well. Just make sure you do it on the universal roster. And if it makes you feel any better, it used to be that all 6 MCOs had different rosters with different formats and different pieces of information they wanted. So this was a huge effort in response to the provider community for all the MCOs to get together and decide on one single format with input from the provider community. So while it's not perfect, it's certainly better than it was. And we don't want to be apologists for the MCOs all the time. I apologize if it seems that way, but it's definitely, we're slowly making baby steps to make things a little better. Yeah.
Hold on, let's look. You had a question here, right?
Oh, yeah, so we're going through the process of registering an impact right now, and one thing that tripped me up was that the 30-day, you have 30 days, and we're using a third-party billing agent, and it's taking us several weeks to get a contract with them, and so now our application is lapsed.
Yeah.
So just for the future, or for a tip, is making sure you have kind of the same thing with doing 2 things at the same time. So really getting your third-party billing agent set and having that contract in place while you're doing your impact application, because our third-party billing person won't let us move forward, obviously, without, she won't let us put in her ID in there
Of
until we have a
course,
contract.
right.
So that's just something
Yeah,
we
and the same
learned.
thing holds true with professional licenses and certifications, making sure that you have those, and that, most of if you have someone working for you that's a, LCPC or whatever, they're going to keep that certification up to date. But, maybe the expiration is going to fall in a window that's right when you're doing your application. Just make sure that all of that is ready to go so you don't fall into that trap.
There's one in the back there.
Yeah.
That was my question about licensure and certification for specific things like the first one, ADHD. Is there some certain certification they're looking for that outside of a LCPC or LCSW?
No, those are really just, let me pull that up for a sec. Because, oops, God, this is not, where are we there? No, these ones are really just for, where that's going to come in is impact, right? So if you, especially on the CMHC side, these are really just for the MCO, because you're not going to fill these out in impact. This is really just for the universal roster. And it's so when they list your agency in their provider directory, that member can see, oh, you have services for ADHD kids, or you have art therapy at your agency, so it's not certification, it's just more your service offering and what you want your clients or your potential clients to know what services you provide. And then, there was another one there.
It was just mentioned earlier, I think, telemedicine. Is that a different subspecialty, or how is that
You
entered
do
into
have
impact?
to have, that's a whole separate billing section, and we're not going to cover that today. It is in the billing guide, though, so, but yes, you're going to have some sort of not certification, that's not the right word, but it's not licensing. But anyway, it is a separate service that's a billable service, and I'm not an expert on it to know, and they've just changed. A lot of that was just in development over the past year, 18 months, in terms of how to bill for it. So I'll get some resources to Carrie to send out to folks, but that is something that, especially on the CMHC side, it is a service that you have to, you can only do it if you're a CMHC, and FQHCs can also do it. And I don't know the rules around that, I apologize.
You referenced the billing guide a few times.
Yes.
What is that?
All right, let me just skip.
I can send it out too.
So, and I'll talk about this after the break, but we have been working with the Illinois Association of Medicaid Plans, gosh, they originally thought it would be a 6-month project. I think we're almost 2 years in now. Creating this comprehensive billing manual. It is on the IMHIP website. If you go to the providers tab, it's one of the first things you'll see is the comprehensive billing guide. Do not print it out. Only use it online, because it's being updated on a regular basis. And you can see these are some of the services that have been added over time. We're working on a practitioner, vision, dental. So we're adding to it on a consistent basis and also updating because, you know, codes change, billing requirements change, et cetera, et cetera. So we always say, don't print it out, just go. And there is a provider notice if you're not signed up for HFS provider notices. They will send out a provider notice every time there's an update or an addition to the billing manual. Oh, sorry, go ahead.
Hi. For a group, for our staff who are providing services, our LCSWs, et cetera, do they need their own NPI or will they use the group NPI?
So you are billing on their behalf.
Correct.
So you definitely need a group NPI. I don't think you do. Now again, I'm not an expert on the whole impact thing, but no, if you're billing, now they'll need to be tied to your agency in some way, but no, you only need the NPI for the payee, who you're actually paying.
And then for the behavioral health specialized training and experience, if I'm remembering.
You know what, I'm gonna go back for a sec though. I think in impact, when you're registering like a MSW, they may require an NPI in the impact. Is there someone, you did impact, they require an NPI for any licensed provider, right? So they're gonna need it for impact.
So we'll each need an individual NPI as well as the group NPI and make sure
In
we're
order to be
associated.
registered at impact, yes, but you won't necessarily need to put it on the bill.
Okay. And then in the BH specialized training and experience, if I'm remembering the universal roster correctly, there are maybe 4 columns for those per provider. Do we then go in and add lines and just
You
keep
can
adding
you can
things under the
definitely add
appropriate
lines,
columns?
yes.
Okay.
And you can make that, you know, if it's, yeah, you can just add more within a certain cell.
Okay, thank
Yeah.
you.
Yeah.
I have a comment.
Uh-oh. Okay.
So we're registered in Impact and we have a universal roster and we have some contracts with some of the MCOs. Our LCSWs that we have do not have their own MPI number. The universal roster does require you to put an MPI. We put our group location MPI underneath that tab or that line or whatever it is. And it's been accepted, so.
Okay, good to know.
I don't know
Like I
what
said,
would
I am
happen.
not an impact expert, and we were trying to get with the state to kind of talk through some of these things, and unfortunately, you know, I don't know if you know, they lost 8,000 kids off the Medicaid rolls last week, so it was a little hairy for HFS. So we weren't able, but that's helpful.
Yeah, I don't know what would happen or what you would put there if they did have their own MPI, but we're filing.
Makes sense.
on their behalf.
Makes
so.
sense, because they're not submitting claims, so makes sense. Anybody else? Jesse?
Sorry, I'm asking a lot of questions. Can you talk just a little bit more about the contracting process with an MCO? In my mind, you know, you all have maybe not you all, but MCOs have templates, and your agency needs to review that and go under legal review and kind of a back and forth. Is there anything important to kind of note in the contracting process that providers should know?
No, I mean, you're gonna have to work with the network specialists. The contracts will all be different between the MCOs. You definitely want legal review because they are different, and you wanna make sure that just as the MCO is doing, making sure they're covered, you wanna make sure that you're covered and there's nothing specific in there that would be a challenge for your organization. But they are generally templates. At the provider, like a smaller agency provider level, they're not usually making a ton of changes to the language, but they also have legal review happening at the same time. So as you're having even though it's a standard contract, any changes you make go through their legal as well. So.
Yeah.
If we have been registered in Impact for several years and are currently working on our universal roster, do we have to go back and check to make sure everything in Impact is legit? And you know what I mean?
Yeah,
'Cause
no, I would look at your provider info sheet, right, and make sure that whatever, you know,
Right.
run a new provider info sheet, whatever. You
Okay.
just have to make sure that if you're using a taxonomy code in Impact, and then you fill out your universal roster and you use a different taxonomy code or a different TIN or a different MPI, you're going to run into trouble.
Okay,
So you just have to make sure some of those
just
key
make
elements.
sure it's all coordinated.
Exactly.
Okay,
Yeah.
thank you.
And the other thing is, if you're registered in Impact and you're billing fee-for-service Medicaid, you don't necessarily have to go in and re-register in Impact. What you may need to do is you're going to have to go in and just identify which MCOs you have contracts with. So you have to like re-register all your providers or whatever. You just may have to go in and make that association within the system. All right, Carrie, I'm going to turn it over to you. I think we're at a
Lunch?
break.